Hi everyone. So the question for today is a 40-year-old male who was in prison complained of left-sided chest pain. He was rushed to the nearby hospital. By the time he reached the hospital, the patient went in for hypotension and expired. Autopsy was conducted to find the cause of death. The following test was performed in the sections from the heart. Which of the following test is performed? Nile blue sulfate test, nitroblue tetrazolium test, triphenyl tetrazolium chloride test, dihydrorhodanine test. Okay. So I know most of you would have excluded option A and D. So your confusion will be between option B and C. Okay. So don't get confused. So I'll make it clear. So the answer here is a triphenyl tetrazolium chloride test. So what is this test and what is it all about? So imagine a patient is going to expire 2 to 3 hours after MI. So now when you're going to conduct an autopsy, when you're going to cut open, conduct an autopsy, see the heart on gross examination, you might not see any visible or suspected areas of infarction because the time is too short for the changes to develop for you to observe grossly. So in such cases, what you can do is you can take a section from the heart and immerse it in a solution containing triphenyl tetrazolium chloride. Okay, triphenyl tetrazolium chloride. So what happens is your heart has got an enzyme called LDH, lactate dehydrogenase. Okay, so in a viable myocardium, you will have LDH. In a non-viable or a necrosed or an infarcted myocardium, what do you mean by infarction? The heart undergoes coagulative necrosis. So there will be rupture of plasma membrane and release of LDH. So whenever you have a myocardial infarction, the cardiac myocytes at that particular place is going to rupture its cell membrane and release the LDH. So you won't have LDH enzyme. Okay, so when you have add this chemical, if you have LDH, it will turn brick red. So whatever appears brick red after adding triphenyl tetrazolium chloride is a viable myocardium. Whatever appears pale, it's an infarcted myocardium. So if you see here, you can clearly see this area appears brick red. So all these contain LDH, they are viable myocardium. Whereas you can see a pale area here. So this is what we call it as a infarcted or a non-viable myocardium. So when the duration of death is very short, 2 to 3 hours, then it's very difficult to make out the gross changes. So you have to go for certain tests to detect or suspect a infarcted area. So triphenyl tetrazolium chloride test is the one which is used to detect these infarcted areas, and it's based on the enzyme activity. So what about the other test? So what about Nile blue sulfate test? So it is used to assess the fetal lung maturity. What about NBT test, nitroblue tetrazolium test, and dihydrorhodanine test? Where have you heard about these two tests? So this is used in chronic granulomatous disease. So chronic granulomatous is due to NADPH oxidase deficiency. Okay. So it's due to NADPH oxidase deficiency. So don't get confused between option B and C. NBT test is used in chronic granulomatous disease. So one more point which I want you to be very clear is, so remember where everyone goes wrong is in chronic granulomatous test, NBT test is negative. NBT test is negative. So if it is negative, it indicates that the patient is having the disease. So we'll discuss this test at some other video. So then you will be clear why negative means disease. Okay. So as of now, remember triphenyl tetrazolium chloride test is going to detect your viable and a non-viable myocardium if you have death within 2 to 3 hours of onset of chest pain. Thank you.